So I'm going to move from this stimulating overview of what electrons can do for us to focus on a much more micro level, which is the individual patient and the family and their experience with care. That is, after all, a large part of what our profession is about. And learning from these people, partnering with them, helping them in a very concrete way to engage far more actively in their care is what raises my motor. So I come from academia, not the commercial world, but today I'm going to also be a drug salesman. I'm going to ask you to consider a drug that some find quite intoxicating, and in fact, I'm actually hoping to create a new addiction. We call that drug OpenNotes. It's got many implications. It's not software, it's not a thing, it's a movement that's early in its evolution, and it can be dangerous. It makes some people really mad, and we need to learn a lot about it. But in our country, its use is spreading like crazy, and I know that some of you are also using it in your nations. So what's my goal in giving such a talk? Giving lectures is a big problem, you know. The vast majority of you will actually remember precious little of what I'll say and show you, but my goal is simple. If I can turn you on, if I can excite you about the infinite possibilities deriving from the name, open notes, music, openness, writing things down, that'll be a worthwhile period of time. I want you to leave this room fired up. So to bring it alive, I'm going to show you a Schloss in Salzburg, a box of tools, a patient with a dangerous mole on her back. And finally, I'm in France after all, I'll show you some naked doctors and patients. And then I'll follow it with some doctors, nurses, and patients dancing the tango. But I'm not going to do it for the Ärzte-Zeitung. I need my own slides, please. Oh, there they are. All right. I've got the wrong slides on the monitor, which is going to make it awkward for me. And this is where technology is so terrific.
I'm going to just change something for you.
Okay.
There we go.
Okay. I own shares in the ELISA Corporation, which is not doing very well. So I'm going to share impressions with you from several years of work with these fully open medical records that I'm really talking about. I'm going to look ahead and discuss some of where I think it'll go, and I'm going to have you please join the OpenNotes movement. And we'll begin in Salzburg 15 years ago. There I was privileged to lead a seminar. One of my faculty members was a young man named Berwick. And we were inventing a new country called People Power. Madam Prime Minister had been swept into office by promising her citizenry that she would create a healthcare system all new through the patient's eyes. And a young Norwegian nurse, I always make this point because everyone has grabbed this, came up with the mantra for our session, nothing about me without me. And we had 61 people from 29 countries, and there were storytellers and musicians and media artists and media people and social scientists and doctors and nurses and philanthropists all working together to create this strange country. Nothing about me, by the way, is not original in Salzburg. It's 400 years old, and those of you who are Polish, I learned recently, nothing about us without us is a Polish aphorism which has lasted a long time. We wrote in a paper that we published from this seminar that not only do patients have nearly complete access to their medical record, although they don't have to review their record if they don't want to, but they'll also write in it, elaborating, tracking, and explicating problems, correcting mistakes, prioritizing needs, and at times suggesting both diagnoses and treatment plans. Now let's fast forward 15 years and talk about OpenNotes. This began in 2010 with 105 doctors volunteering. These were primary care doctors and 19,000 of their patients to participate. And this was in rural Pennsylvania in a large integrated healthcare system, in urban Boston in an academic health center, and in the inner city in Seattle, in Washington, where they served the underserved. These doctors invited their patients to read the notes they wrote about them after each visit. So Stefan comes to see me. I sign a note saying your pulse rate of 74 is a little rapid for a young man. McKinsey's working you too hard. You should relax a little bit. And he can read that note from now on and take it under advisement. This is what happened. 18 months later, 18 months after we published the findings from this one little study, we have more than 3 million patients in the United States. Thousands of doctors, nurses, therapists, trainees, physician assistants, case managers, and other clinicians sharing notes. What's going on here? We asked 3 questions in our study. Would OpenNotes help patients become more engaged in their care? Would OpenNotes be the straw that breaks the overworked, beleaguered, depressed, crazed primary care doctor in the United States? Would it break his back or her back? And after 1 year is a very simple research question. Would they want to go on with it? Doctors were scared of what we were doing. About 50% of those volunteering to participate expected disruptions in their workflow, and about 80% of those who told me to go to hell were scared of disruptions in their workflow. They expected to change writing about such issues as mental health, substance abuse, and cancer. And a year later, what happened? Only 3% reported longer visits or answering more questions afterwards. The most common question we got during this study was, are you sure this is going on? Are you sure the computers are working? Are you sure the patients are getting these messages? And I don't have time here to talk about why there was so little disruption to their flow, but you can think about it and we can talk about it later and you can read about it. About 25% did indeed change the way they wrote notes, and they aimed them more at the patients, they tell us. And one of the things I want you to think about is, for whom should notes be written? Should it be written for me, for my colleagues, for the patients, for everyone? Can you write one note that serves everyone well? An open question, not an easy one. Patients, on the other hand, were totally berserk. They want the notes. They're not scared stiff. They read them, they share them, and they report important clinical benefits. 4 out of 5 of them read at least one of their notes, and many of them read all of them. 1 out of 5 chose not to read their notes. Freedom, right? Democracy, choice. Very few were scared, confused, or worried by the notes. It brings up a fascinating issue of confidentiality and privacy. People worry about privacy, particularly when they feel well. They don't when they're sick, and they don't when they go to the emergency room. But confidentiality is the bedrock of the doctor-patient, the nurse-patient relationship. I can be fired from my hospital if Stefan's my patient and I talk with any of you about what I think about him. On the other hand, whether my note is now private is up to Stefan. And as he already implied to you, he can post it on Facebook. Delbanco says I should do X, Y, and Z. What does the rest of the world think? What does that mean? What are the implications of that if you think about it? Fascinating. And look what happened already. 20 to 42% of our patients shared notes with others, and we expect in the future it'll be a much larger number. This is what really excited us. Patients reported very important clinical benefits. We surveyed them before and we surveyed them afterwards. 80% felt more in control of their care. 80% reported understanding their conditions better. 80% reported remembering the plan for their care better. And 80% or 70% felt better prepared for subsequent visits. And look at this one. This is really fascinating to us. 70% said they were taking their medicines better. These were people on medicines, and they reported doing better with taking my medications as prescribed. This is an extraordinary number. If it's a 5-fold exaggeration, if the number is really 15%, that is still a striking result because I've spent my life trying to improve adherence to medications by 1 or 2 or 3%, right? True for many of you. And we did focus groups afterwards. We did many interviews. And as you'll see in a minute, there's something here that's real. We're actually studying it right now. 99% of the patients wanted to continue with OpenNotes, even if they didn't read them. One young woman in Maine said, I want to have everything, it's mine. As Stefan was implying, the data is mine, I want to have it, but I may not read it. It's okay, it's a matter of who's in control. 85% said the availability of these notes would be a very important factor in their choosing what to do in the future with respect to the care they got. Not one doctor asked to stop. They were in a controlled trial. They had the right to drop out. Not one doctor asked to stop. They didn't all like it. They didn't all love it, but no one dropped out. And all three of the institutions decided to expand this practice very widely. We now have thousands of patients at our hospital, many, many thousands, and now 1,000 doctors, nurses, all kinds of people signing notes online and then asking patients to share them. And that's true at Geisinger in Pennsylvania, and that's true in Washington. Listen.
I always wondered.
To some patients.
What is he writing? What's he saying about me? And I think there's a kind of mystery that many patients feel about whatever it is the doctor is writing.
I want to be a partner. I want to really be on board with my health. I don't want to be in the dark. I don't want to have the doctors have access to things that I don't. I want to know.
So you can look at the comments that Bob writes down, and sometimes, you agree with them, sometimes you don't agree with, but that's the way it is. And, I know what's right for me, and Bob knows what's right for me, and sometimes they clash in that, and then Bob and I talk about it, and it works out. We work things out.
I think one of the not so apparent but real values is that people will share them with others. They will be able to have much better communication, much better conversation with their loved ones, with other professionals, because they have a written record that they can pass on, either by forwarding it or printing it out and showing it.
Last year when I was pregnant, I had gone to see my primary care for a checkup, and everything, thank goodness, was fine, but she did notice a mole on my back that she had asked me to follow up with at the dermatologist. But being pregnant, I had forgotten all about it. I remember a few weeks later, there was something nagging at me. And then I was reading through my notes, and I saw the notation that said, referred to follow up with dermatologist. So I immediately went to the dermatologist, and she felt that it needed to be removed. I was so incredibly relieved, primarily. And I felt this sense of safety as well, because I actually had a hand in what was going on with my own health care.
Even though I'm really healthy, I know that the moment I don't take my pills, something could go bad. And I don't want things to go bad. Having it written down, it's almost like there's another person telling you to take your meds.
I guess I am somebody who believes that trust will be easier come by between doctor and patient if there's more candor and openness. OpenNotes is a cultural change. Doctors and patients and family members who know that there's a level of transparency will shift their behavior towards honesty and candor.
You and I used to share information when I would go to your office without OpenNotes. OpenNotes is just like the period at the end of a sentence, okay? It helps me understand what you're doing because I didn't have major surgery, but I know what's happening with me.
It's about me, and I want to know what's going on with me. And that's the most important thing.
So this seems to have had resonance. E-patient Dave, some of you have heard about or seen or read, an extraordinary guy, a patient at our hospital. He's written a book about Let's Patients Help, showing the kind of consumer movement that's coming out of this kind of transparency and openness. Translated everywhere, it's even in France. Laissez les patients aider. Let the patients help. Look at what's happening in our country with the 3 million people. Look at these organizations. Cleveland Clinic, Mayo Clinic, MD Anderson, the largest cancer center in the hospital, our hospital, and the whole U.S. Department of Veteran Affairs. And just yesterday, we announced in Portland, Oregon, that 1 million people served by 9 deadly competitors are all going to get OpenNotes. There's a consortium in Portland, Oregon that have gotten together and decided they would all do it. It includes Kaiser Permanente, who invited yesterday 500,000 patients to read their notes online from now on. So this is a virus that's spreading fairly rapidly. Consumer Reports, one of our partners, the consumer agency in the country, wrote in an editorial in JAMA last December, in light of these results, why not make this the standard of care? This doesn't depend on technology, and for those who have electronic records, any challenges posed by technology can be readily overcome if the will is there. They wrote to the citizenry of the country. We wrote in the New England Journal of Medicine a month later that despite the challenges that we face, we anticipate that open electronic records will become the standard of care, accompanied by electronic tools, as you heard about, that explain medical terminology and abbreviations, translate notes into different languages, and adjust for health literacy levels. Now listen to some of the doctors and nurses who are providers in this and let them talk to you a little bit about their experiences.
This is a clear step towards, this is about you, this is what we're doing, this is why it's important, and it just brings the patient into that whole discussion just a little bit more.
This is a powerful tool. There's something about seeing something in writing that I think may be very powerful to amplify and reinforce a plan or a priority.
It's very important for patients who have chronic disease to feel like they understand what's going on and they know how to slow it down and sort of manage it.
If you've been just on a teaching session with a new diabetic about how to check their blood sugar and what kinds of changes they need to make in their diet and what kind of changes they need to make in their exercise, the documentation of that is exactly the kind of thing that you want the patient reading and either using it as a cue to remember what they're supposed to do, in fact, potentially seeing something that they didn't understand the first time and then reaching out via the OpenNote process to get clarification. Those kinds of things will very much be coming, I think, out of nursing notes.
There's no question in my mind that those people who became engaged in the program became more engaged in their own health care. They came better prepared for their visits. They asked better questions. They knew their medications and their doses when they came in.
If it's a sensitive issue, I tend to discuss it with the patient during the visit, and I haven't blocked out certain parts of a patient's chart so that they are not able to view it.
It shouldn't be different from the conversation that we have in the office. And if that conversation was difficult, which sometimes it is, then the note will reflect some of that difficulty.
Trust goes up dramatically with OpenNotes. Patients still think that the medical system is allowed to withhold information or does withhold information. And very often I had patients say, I'm glad I saw this because now I know there was nothing that I wasn't being told.
All of us who are nurses went into this because we want to help people and take care of people and make their lives better. And now you're going to get the voice of the patient in a much more ongoing way about how you've affected their life. Every nurse likes that moment when the patient turns and says, will you be my nurse tomorrow? Or I'm so appreciative of everything you've done for me. And the notes themselves are going to give you that connection with the touches you've had on the patient, the impact you're having on that patient over time. So I think that's going to be the piece that people find most satisfying, to feel like you have a continuing, ongoing relationship and that you're adding more value to the patient's healthcare journey.
So we're excited by this, but it's a tough business. This is a new medicine. Every new medicine known to man or woman hopefully works for more people than it hurts, but everyone has side effects. We have to learn to use this medicine well. We meaning patients, and we meaning those who care for patients. It brings benefits and it brings risks. People are lusting after learning how to use it. This is our website. We posted 1 month ago our toolkit, which is directed toward patients, how to use OpenNotes, towards providers, how to deliver, how to think about the notes they write. No longer will I write SOB, right? SOB to me means shortness of breath. SOB to some of you means something different. We have to be clear about that with our patients. These damned abbreviations that I can't understand anyway will have to go away. We're beginning with ophthalmology soon, but we've told the ophthalmologists that before they show their notes to their patients, they've got to write them so that we doctors can understand them. It's a complicated business. We published this toolkit 1 month ago. There have been 934 downloads of it as of yesterday. People are thirsty for learning how to do this. So where's this all going to go? We have some clues from our initial study. 1 out of 3 patients in the study said they wanted to be able to approve what we wrote in a note. And remember Salzburg? 3 out of 5 patients wanted the ability to add comments to their notes. This is going to change a hell of a lot of stuff, and not just in ambulatory care where it started. It's going to spread into the hospital, in our hospital this year, and in many other institutions. It's going to come into nursing homes, into recuperative facilities, into all kinds of settings. It's going to go into the home. Stefan showed us and reminded us how much work is going to happen in the home in the future. This will be an avenue. You need, I think, full transparency for that. And it will take over our machines. This is our patient portal. We've had it for 15 years. You can look up your laboratory work. You can get appointments. You can see what medications you think you're on. And now you can read your notes. This kind of thing is going to spread everywhere. Kaiser has it. We have it. Many, many American systems have it. And you will have it around the world if you don't already. Think of the implications for patient safety. Another set of eyes looking at what's happening. We have many anecdotes already of really important errors, whether they be medications or masses that were mentioned but not followed up on, or misunderstanding in family history. We have a big grant to study this from the people who insure health care in our country because they think this could really make health care safer. Think about the caregivers. Your father went to the doctor the other day. His knee hurts, he can't breathe, and he can't think straight, and you call him up and he said everything was fine, right? You would love to read that note. You would like to see what the doctor really thought. There's a large movement in our country for giving access to family members, proxy access, so that they can understand what's happening with their family members and help them. Caregiving can be a disease in itself. There's morbidity for caregivers. We think this has enormous implications for caregiving. Think about medical education. Why shouldn't a patient critique the note that the young doctor or medical student or nursing student or someone else wrote? I, for many years, wanted to give Harvard faculty appointments to my patients when they spent all the time with my students. This is a new avenue for them to think and help us write more efficiently for people. Think about mental health. This wonderful painting by Degas. I think she's depressed. You may not. The reason I left town actually to come here in part was a paper that we published last week in JAMA, in which we said, let's show patients their mental health records. There's been Sturm und Drang in our country about it in the last week. People are blogging, people are writing articles. We were on the front page of the Boston Globe. I got a frantic letter from our head of development. She raises money at our hospital. One of our trustees wrote her a note saying, this is the worst idea I've ever heard of in my life. Can I talk to someone? And I said, no, I'm in Paris. But think about what the implications here. The note becomes part of the treatment. Whether it's for your knee, whether it's for your heart, or whether it's for your head, why should that not happen? And the next iteration, I think, will be our notes, from OpenNotes to our notes. Remember the problem-oriented record, SOAP, subjective, objective, assessment, and plan. Subjective is what the patient experiences. Why shouldn't he or she write that up and provide it and think about it before they come to see us. Objective is what we assess, what we see in the room, when we see that cardiogram or that pulse rate or that respiratory rate. Assessment could be done jointly. It doesn't mean a darn thing if I make an assessment that the patient doesn't agree with. It only means something if we can come together on that. And similarly with plans. We need really separate plans. Back to Salzburg, the patient needs a plan, the doctor or the nurse needs a plan, and that in effect becomes a contract. It's an agreement. We could measure that. We could measure that as a measure of quality of care. Delbanco says he's going to do the following over the year. Patient X says she's going to do the following over the year. Let's see after year how well they did, where it went. Think of the excitement that that could bring. So what am I talking about? What have I talked about? I'm talking about enhancing communication. I'm talking about engaging. I'm talking about trust, and trust that goes both ways. Trust from the patient about me, and trust from me to the patient. And I'm also talking, I hope, about the best possible outcomes enhanced by this kind of engagement. This is the level playing field. This is shared decision-making. This isn't informed decision-making. This is shared decision-making, and now come my naked people. I always learn from the New Yorker, and here we go, France. Okay, can we get dressed now? All right? And 15 years ago, Tessa Richards arranged a cover of the British Medical Journal, which I think expressed things beautifully and was apparently the cause of some trouble in England when she published this wonderful, wonderful title. And the issue that I bring from this one now, 15 years later, is who's the doctor? Who's the patient? Or is it a nurse? The point is that we're all together and we're dancing. So, thank you very much, everybody. Have fun with this. I want you to stand up and be excited by what we're doing. I want you to join us. I want you to teach us. I want you to teach yourself. This is just opening the door. This is just a foundation. It's transparency as a new way of thinking about where we're going. Have some fun with it. Tell me where I'm crazy. And enjoy Paris. Bye-bye.